Have you ever heard of a medication being used for something other than what it was originally approved for? This is called off-label prescribing, and it's a hot topic right now, especially concerning certain diabetes medications. Let's dive into what this means, why it's happening, and what you need to know. So, what exactly is off-label use? When a drug is approved by a regulatory body like the FDA, it's for a specific condition, at a specific dose, for a specific group of people. That's its label. But doctors, using their professional judgment and experience, can legally prescribe that same drug for a different purpose. This is common practice in medicine, often happening when scientific evidence suggests a drug could be effective for other conditions, even before it gets official approval for them. Common diabetic medication that are prescribed off-label are GLP-1 receptor agonists, SGLT2 inhibitors, and biguanide. Now, let's talk about the medications making headlines. GLP-1 receptor agonists. You might know them by names like Ozempic or Wegovy. Originally, drugs like Ozempic were developed and approved to help people with type 2 diabetes manage their blood sugar levels. But researchers and patients noticed a significant side effect: weight loss. This wasn't just a minor thing. Many people experienced substantial weight reduction. This discovery led to further research. Eventually, the same active ingredient in Ozempic, semaglutide, was studied specifically for weight management in people without diabetes. The results were so impressive that a higher dose version was developed and approved under a different brand name, Wegovy, specifically for chronic weight management. So, prescribing Wegovy for weight loss is on label. Prescribing Ozempic for weight loss in someone without diabetes, however, is technically off-label. Why would a doctor prescribe Ozempic off-label for weight loss instead of Wegovy? It can come down to a few factors. Sometimes it's about availability. There have been massive shortages of these medications due to skyrocketing demand. A doctor might prescribe what's available at the pharmacy. Other times it could be related to insurance coverage. An insurance plan might cover Ozempic but not Wegovy, making the off-label route more affordable for the patient. But this trend has created a huge ripple effect. The surge in demand for these drugs for weight loss has led to global shortages, which is a serious problem. For people with type 2 diabetes who rely on these medications to control their blood sugar and reduce their risk of serious complications, not being able to get their prescription is a major health concern. It's a complex situation where the needs of one group can inadvertently impact another. So, is off-label prescribing safe? It really depends. When a doctor prescribes a medication off-label, they are weighing the potential benefits against the potential risks for that individual patient. They consider the existing scientific evidence, the patient's health history, and other treatment options. For GLP-1 agonists, there's strong evidence they work for weight loss. However, like any medication, they come with potential side effects, like nausea, vomiting, and other gastrointestinal issues. More serious risks, though rare, can also exist. That's why having a conversation with a qualified healthcare professional is absolutely crucial. Self-medicating or getting these drugs from unregulated online sources is incredibly risky. You don't know what you're actually getting, and you won't have the medical supervision needed to manage side effects or ensure it's the right choice for you. In summary, the off-label use of diabetes medications for weight loss is a powerful example of how medicine evolves. It highlights a real need for effective weight management treatments, but it also shines a light on the challenges of drug shortages and healthcare access. If you're curious about these medications, the best first step is always to talk to your doctor. They can help you navigate your options safely and effectively. Now we will dive into another exciting example: XL2 inhibitors. So, what exactly are SGLT2 inhibitors? These are a class of medications originally developed and approved to treat type 2 diabetes. Their main job is to help the kidneys remove excess sugar from the body through urine, which helps lower blood sugar levels. Pretty straightforward, right? Well, during the large clinical trials for these drugs, researchers noticed something incredible. Patients taking SGLT2 inhibitors, like empagliflozin brand name Jaridance, or dapagliflozin brand name Farxiga in the US and Farxiga in Europe, were not only managing their diabetes better, but they were also experiencing significantly lower rates of hospitalization for heart failure and were showing signs of improved kidney function. This was a massive discovery. It was like finding out your new smartphone can also make you a perfect cup of coffee. Doctors and researchers realized these medications had powerful protective effects on the heart and kidneys, completely independent of their ability to lower blood sugar. Think about it. Heart failure is a serious condition where the heart can't pump blood effectively, and chronic kidney disease can lead to kidney failure. Having a new tool to fight these conditions was a game. This led to a wave of new research focused specifically on patients with heart failure and chronic kidney disease, even those who didn't have diabetes. The results were consistently positive. Study after study confirmed that SGLT2 inhibitors could reduce the risk of cardiovascular death and slow the progression of kidney disease for patients with heart failure. These drugs help reduce congestion and fluid buildup, easing the strain on the heart. For those with kidney issues, they help protect the delicate filtering units of the kidneys, preserving their function for longer. Because of this overwhelming evidence, regulatory bodies like the FDA have now officially approved certain SGLT2 inhibitors for treating specific types of heart failure and chronic kidney disease, regardless of whether the patient has diabetes. So, what started as off-label use, based on surprising but positive side effects, has now become a standard on-label, evidence-based treatment. This journey from a diabetes drug to a heart and kidney protector is a perfect example of how medical science evolves. It highlights the importance of continuous research and observation. A doctor might prescribe an SGLT2 inhibitor to a patient without diabetes today, not as an experiment, but as a primary treatment for their heart or kidney condition, backed by solid scientific data. Of course, like any medication, SGLT2 inhibitors aren't for everyone. They have potential side effects, and a doctor needs to carefully consider a patient's overall health before prescribing them. Because these drugs work by helping your kidneys flush out extra sugar through your urine, it creates a sugar-rich environment down there. This can increase the risk of genital yeast infections in both women and men, as well as urinary tract infections, or UTIs. It's crucial to practice good hygiene to help minimize this risk. Another common effect is that you might find yourself needing to urinate more often, especially when you first start the medication. This is just a drug doing its job. However, all this extra urination can lead to dehydration, so it's really important to drink plenty of fluids throughout the day. Some people might also feel a bit dizzy or lightheaded, especially when standing up. This can be a sign of low blood pressure, which is something to keep an eye on. Now, let's move on to some of the less common, but more serious side effects. While rare, there's a risk of a serious condition called diabetic ketoacidosis, or DKA. What's unusual is that with SGLT2 inhibitors, this can happen even when your blood sugar levels aren't super high, a state called euglycemic DKA. Symptoms to watch out for include nausea, vomiting, stomach pain, feeling very tired, or having trouble breathing. If you experience any of these, it's vital to seek medical help right away. Another rare but very serious side effect is a severe infection in the genital area called Fournier's gangrene. It's an emergency that needs immediate medical attention. Symptoms include pain, redness, or swelling in the genital or perineal area, along with a fever. So, the next time you hear about a medication being used off-label, remember the story of SGLT2 inhibitors. It's a testament to the dynamic and ever-improving world of medicine, where unexpected discoveries can lead to new standards of care and offer new hope to millions of patients worldwide. Moving on, Metformin, a biguanide anti-hyperglycemic agent, is another example. Its primary job is to lower blood sugar by reducing the amount of glucose your liver produces and improving your body's sensitivity to insulin. But researchers noticed it has some other interesting effects. One of the biggest off-label uses for metformin is for Polycystic Ovary Syndrome, or PCOS. PCOS is a common hormonal disorder in women that can cause irregular periods, fertility issues, and metabolic problems like insulin resistance. Sound familiar? Since insulin resistance is a key feature of both PCOS and type 2 diabetes, doctors began to wonder if metformin could help, and it turns out, it often does. For many women with PCOS, metformin can help regulate menstrual cycles, improve ovulation, and even assist with weight management, which is often a struggle with this condition. But the story doesn't end there. The world of medical research is exploring even more potential uses for metformin. Some of the most exciting research is in the field of anti-aging and longevity. I know, it sounds like something out of science fiction, but hear me out. Some studies suggest that metformin might mimic the effects of caloric restriction, a known method for extending lifespan in many organisms. It appears to activate certain cellular pathways that are linked to reduced inflammation and better cellular repair. While we are still a long way from calling metformin a fountain of youth pill, the research is incredibly promising and ongoing. Beyond that, scientists are investigating metformin's potential role in cancer prevention and treatment. Some research has shown that it might slow the growth of certain types of cancer cells and improve the effectiveness of other cancer therapies. Again, this is an area of active investigation, and it's not standard treatment, but it highlights the incredible versatility of this old drug. Now, it's really important to stress that metformin is a prescription medication for a reason. It's not a supplement you can just pick up and start taking. It has side effects, with the most common ones being gastrointestinal issues like nausea or an upset stomach. It's also not suitable for everyone, especially people with certain kidney or liver problems. Self-medicating is never a good idea. Any decision to use metformin, whether for diabetes or an off-label purpose, must be made in consultation with a qualified healthcare professional. They can assess your individual health profile, weigh the potential benefits against the risks, and determine if it's the right choice for you. Have you heard of other off-label uses for common medications? Let me know in the comments below. I'd love to hear from you. Thanks for watching. If you find this video helpful, give it a thumbs up and subscribe for more health insights. See you next time.